Can you hear me all right? Okay, excellent. Good morning, and welcome back to campus. Look at all of you, holy. It is, of course, so great to be here, and we are very excited to hear about your own experiences and the learnings that you've obtained over the course of your practicum and how they relate to our program and so forth. My name is Michael Hayes, and I'm the Director of the School of Public Health and Social Policy, and I would like to welcome you all, and of course remind ourselves that we are meeting today on the traditional unceded lands of the Coast and Strait Salish people. It's been my pleasure to be a visitor here for about 28 years, and I originally am from Hamilton, Ontario, and I tell my family that I need to weightlift. I tell my family, can I get a little bit more volume on this, please? That the only way I'm leaving this part of the world is in an urn, because it is such a great place to be. Just before we begin, I do want to just do a couple of housekeeping things. We will be providing lunch, and there will be a health break with some refreshments and so forth later this morning. Those of you who are on set to give your presentations in particular blocks, we would just invite you to sit up here so that you be ready for the presentation, because we are running this as a conference format. And one of the things about conferences, of course, is that they're very strict timetabling issues. So we actually have in our studio audience today a couple of timekeepers. You can see Betty there with an orange card, and beside her is Victoria. And whilst they are typically gentle souls, when it comes to the conference format, you will unleash the tigers if you do not kind of follow the time. I mean, honestly, folks, partly that is because in conferences, there are tight schedules, and really in respect to everyone's desire to participate and share their ideas, we really do need to try to keep to a schedule. So that's number one. Washrooms are just inside the foyer if you're not familiar with this building. I would like to say a special hello to those of you who are watching this event online. If you could see this room, you would see that we have a lovely studio audience filled with some of the brightest minds in public health today, and as will become apparent to you over the rest of today and tomorrow. One of the things that is traditional about our meeting, so you will know that we have a BA in public health, in community health, in health and community services, as well as an MPH in public health and social policy. And so this is an integrated group. We have those who are doing undergraduate work and those doing graduate work. We like to start our Culminating conferences, and this, of course, is the third time that we've had the opportunity to have a Culminating conference in this program, with keynote speakers who can speak from their own experience to these important areas of activity. It is my pleasure to introduce Catherine Schissel. Catherine works for the Children's Foundation of Vancouver Island. She previously worked with the United Way and has years of experience working in community and social service sectors. So she's here today to reflect on her experiences of working in this sector, and I would like you please to join me in welcoming Catherine Schissel.
My pointer box. Good morning, everyone. As Michael said, my name's Catherine Schissel. I'm the Director of Community Investment for the Children's Health Foundation of Vancouver Island. Previous to that, I've worked a number of years in both United Ways here locally as well as in other parts of the country, and actually have spent the better part of, dare I say, 25 years working in the nonprofit sector. I am very passionate about it, which is when I said to Michael, don't you want someone who actually knows something to speak to your students? And he said, no, I want somebody who's passionate. And I thought, okay, that I can do. I'm absolutely passionate about the sector. I've dedicated, like I said, my entire professional career to working in this sector, and I fundamentally believe that a strong nonprofit or a strong community sector really is the measure of a vibrant community. and I'm here to tell you a little bit more about that. But before we can absolutely talk about what's going on today, the historian in me wants to give you just a little overview onto why we are where we are today and some of the conditions that we're facing as a sector, because they really do come from some historical context. And I'm a wanderer, and these things make me nervous. So if I take a header, don't panic, I'll be back up. So to understand the historical context, we need to understand a little bit about pre-World War II. And the fact that prior to World War II, there was no such thing as a nonprofit sector. There wasn't really even much talk about health and community services in the way that we talk about it today. What we had in pre-World War II was a charity model, mostly run through churches, women's organizations, very much a gendered role for women, the whole charity model. And it really was about helping people who needed help. The foundation I work for has a 90-year history. We are part of that charity model. We were founded in the early, mid-1920s, somewhere around there. And it was founded by the Women's Institutes of British Columbia because they were seeing and hearing from especially mothers, but families, about children that had extraordinary health needs and there was no help for them. There was nowhere they could go. So they actually created a site. They created a site in Mill Bay. It was actually called a sanatorium at the time, but it was all about taking the most sort of, basically the best practice understanding of how to deal with children that had polio and TB and things like that, bring them to a setting where there was fresh air and ocean air and sunlight, and actually care for them. So that's the roots, and that really is a charity model. That is okay, there's people here in need who need this. We're going to create something to care for them. Now, charity literally means it's a voluntary act of helping those less fortunate, or as is often referred to historically as the needy. Now, there are two challenges with the whole charity model in my mind. The first one is the idea of voluntary. So people with capacity, and often we're talking financial capacity, can help if they so choose to. But they can also choose not to help. The second issue around the charity concept as it was formulated pre-World War II is it was about, and I'll help those that I think need it. And that's a slippery slope down to the whole notion of deserving poor or deserving needy. So if you're living your life in such a way that I agree with and you still get into trouble, I'll help you. But if you're doing things that I may not agree with, I'm less likely to belly up and help out. So the charity model, although don't get me wrong, some of those organizations historically did tremendously good work, and some of it was really forward-thinking. But it was founded on two, I think, pretty unstable principles that we still see today, but to a lesser degree. So what happened after World War II? We know that there was a boom. We know that we had an economic boom, especially from 47 to 73. This was worldwide. This was especially in the western part of the world. The economies were developing very rapidly. And with that came a whole debate about what is the role of the state in economic development and conversely social development. And it was through this period where government started to debate that. We have the social democratic principles being infused through Northern Europe. And we have a little bit more of a market orientation in other countries, especially in the United States. But at the end of the day, there was a consensus around, let's say, the Western world, that national governments needed to play a leading role in guiding and developing the economy, and also any kind of social policies and social services that are required to care for their population. So we see the beginning of the welfare state, especially in Canada. And what that meant in Canada is the creation of unemployment benefits, child benefits, the creation of a healthcare system, social housing, education supports. For those of, probably none of you, I went to university, my undergraduate degree back in the day when the government forgave most of your loan. I mean, there really was a system in place. And I'm not that old, by the way. There really was a system in place that ensured that there was equal access for everyone, as well as, of course, welfare provisions. And how was this done? It was done because it was supported by a fair taxation policy. Again, the belief that people should be taxed based on their income, and that should be used to support both physical infrastructure and social infrastructure. Is that in my head? And what that means is we would have a commitment on a national level to deliver those services. It also meant the creation of systems of care, health care, social services, child services, and within that, a place for nonprofits to play. It wasn't a huge place because there was actually system responses and government policies and programs to care for people. But what it did do is it allowed nonprofits to play in a role that historically made sense, which was in the filling in the gaps role. So where government wasn't necessarily meeting needs, or where government was meeting a certain level of needs, but there were extraordinary needs beyond that, nonprofit organizations started to look at how could they support, how could they shore up that welfare system where there's still small holes, could we plug them? So it didn't impact nonprofits in the way that you're going to see post-welfare state. But what it also did, and what's very important, is there was a commitment to fund these things. So this was the era of government funding. This was the era of core government funding for programs, especially programs that had a strong relationship with government and were part of their system of care. That changes. And it starts to change in the late 70s and the early 80s, where there begins to be another dialogue around the role of the state in the economy. This time, shifting tides with the state actually starting to be seen as not having that role, that actually the market should be directing the economy much more strongly, and therefore also having more of a role in the social development part of a nation. So you start to see the retrenchment of the state in this role. And of course, I'm sure you've all heard, I mean, we call it the rise of neoliberalism. It's the shift, it's a global economic shift from strong state intervention, both in the economy, but it's not just in the economy because that trickles down to everything we do, and this move towards a much more free market. Radical neoliberalism actually argued that government didn't have a role in funding schools, roads, hospitals, nothing. That actually that should all be done through the private sector. The problem with that is these are not money-making endeavors, many of them. And if the private sector is going to get involved with them, there's going to be a shift in how we deliver services from what we had during the welfare state, which was this notion of universality, to a payer-user fee type of model. So what was the impact in Canada? Well, we saw the retrenchment of the Canadian government, the federal government, in funding and actively participating in programs. If you think of things like they started to pull out of social housing, the federal government basically is non-existent in terms of funding social housing in this country anymore. It's been downloaded. It's been downloaded to the provinces, and it's been downloaded to the municipalities, and ultimately to the community. And the problem with that, for people who say to me, why is that such a bad thing? The community's best positioned to deliver services. And I always say, yeah, in many ways that's true, but they didn't download the money. You need the money to be able to do this. And if you think about it, the federal government has the largest tax base, the municipal government has the smallest tax base. Today, it's the municipal government that's trying to do this work with their tax base. It's impossible, you can't do it. So we have this domino effect that's happening both nationally and all the way down to the community. And in that short period of time, we're talking about in the mid-70s to 80s when the debate started, it really doesn't happen until through the 1980s and the early 90s where we see this profound shift in the role that the government believes it has in what we call the social contract with its citizens, which is you elect us, we tax people, and we give back services. We see them pulling back on that. And in that short period of time, we have seen serious repercussions already in this country. And if you think of things like the growing inequality, I mean, it just astounds me every time I see the new statistics around the gap between the very, very rich, and it used to be the very, very poor. It's the very, very rich and everyone else. And we have this shrinking middle class that's shrinking for the first time in quite a serious way since that World War II boom that I was talking about earlier. And I like to use the issue of child poverty as a very good example. We have one of the highest rates in the world for a developed country, for a Western industrialized country. And ironically, this province, we have the worst child poverty rate in the country. So here we are, a very wealthy nation, and we have a growing child poverty issue, and an issue that's been on the radar screen for a very long time. We had a government come out back in the early 2000s saying that they were going to eradicate child poverty. The irony is this whole notion of child poverty is kind of a funny notion too, because kids don't just pop up out of the ground. Kids live in families. What we're talking about is poverty. We're talking about family poverty. We're talking about the fact that children live in families. But the point I'm trying to make this morning is that in a very short period of time, we have seen serious social repercussions that I think for those of us that grew up in the welfare state days are really quite shocked by, because we never thought we would see this in our country. So what does this mean for the nonprofit? It's the good news and bad news story. The good news is that downloading has forced the creation of an extremely, extremely resourceful and vibrant community sector, doing a tremendous amount of work. It's seen by the government as having been extremely successful because they have downloaded without a lot of repercussions. Because one of the things about the nonprofit world, and I don't know how many of you have experience working in organizations. Can I just see a quick show of hands? How many of you? So those of you know. One of the things about community organizations is they will kill themselves to meet the need. They will do whatever it takes to meet the need. And they'll do it with less and less resources. Well, what a dream for a federal government, and actually a provincial government in many ways. But it's not a sustainable model. It's not a just model, and it's certainly not a sustainable model. So we have a sector that's responding. It's responding very, very well in some ways, but there are very, very serious repercussions that are happening. The level of burnout is very high. You're getting more and more organizations closing their doors or saying we can't do it. They're spending more time chasing funding than they are delivering programs. So today, we have a nonprofit sector that is one of the fastest growing sectors in North America, which again, I find quite astounding when you think about what they're doing and how little they're doing it with. So it's the fastest growing sector in North America. There are 150,000 nonprofits in this country, which is good news and the bad news. The problem is there's also maybe potentially too many. I mean, when we start to talk about resources and administrative resources and the fact that it gets stretched so thin. What I find interesting is that it's a sector that contributes 7.8% of the Canadian GDP. That is more than the retail sector. And you can say, okay, oh, fine, the retail sector, we see that, sort of struggling. But it's also the same size as the mining and oil and gas industries combined. Now think about the attention that both sectors get. So again, this is a really important sector. This is a sector that contributes 7.8% of our GDP. It employs 2 million people, and another 12 million people volunteer in this sector. So again, it's an extremely vibrant sector. And despite all their challenges, they're doing fantastic work. I have had such a privileged career in many ways because I've had the opportunity to work with United Ways, and I'll put it on the table right now. I'm a very big supporter of that concept, of the concept of everyone in a community being able to give back to the community. I was raised by, my parents went through the Great Depression. So my parents raised us very, very strongly to believe in community, and that we had a responsibility to give back to community. It wasn't about waiting for programs to arrive at your door. It wasn't about the very rich giving back. It was about everyone giving back in the way you can, in the capacity that you can. This is a sector that has done that. United Way has allowed us to create these networks of community services that have taken that social safety net, for better or for worse, and they have, with some, hard work and tenacity and some gum and some duct tape, they've more or less plugged those holes so that people are cared for. And I've had a wonderful opportunity to meet so many of those people. Organizations in this community that are doing such profoundly important work and doing it in such a quiet way. There's organizations working. We know the big organizations, and I'm a big fan of the big ones. Our Place, Kool-Aid. We've got some great work happening in the area of housing and homelessness in this community. When you think again about the fact that there's next to no federal dollars being put into that, but there's little organizations. There's an organization called Oasis that is this 1.5 person organization, and they're passionate about people who can't be helped anywhere else. And their focus is all those people who would die on the street because you can't get them into shelters because they're not going to comply with rules and regulations that are so severely addicted and have such long histories of trauma that there's just no program out there to help them, because at the end of the day, a program is still a box and you have to fit into it. Here's an organization. It's mostly volunteer run. Like I said, there's I think a staff and a half maybe now, and all they do, their whole journey is wrapping around the most marginalized and traumatized people in our community, and they just wrap around them these supports, and they just go on this journey with them. And the journey looks like this, because for anyone who's dealt with it, worked in the area of mental health and or substance use knows that this is the journey. And it's this most amazing thing to watch these people literally save lives and watch people come out the other end, because they actually do. And you don't get that anywhere else. There's nowhere else that you actually are allowed that kind of creativity and that kind of customization. Now you can say, yeah, but that's a handful of people. We've got, this huge amount of people over here. We need it all. We need the mass programs that work for people, and then we need other organizations to go in and focus on some of those individuals. And that's what's so exciting about the nonprofit sector, is you get that. You get this weird kind of, it's almost like a chaos theory you get of organizations, but they somehow self-manage and figure out how to care for everyone. And it's a really interesting thing to both be in the trenches and doing that work, but then be able to work in an organization where you can elevate yourself and watch that happening, because it is a most sort of profound thing to watch. But the sector has problems. And I alluded to it earlier when I said doing more and more with less and less. That's a great concept for a funder. That's not a great concept for the people delivering the services, and it's not a great concept for the people that are actually needing those services. Because at the same time that's happening, we've got social issues growing, we've got complexities happening all over the community, and we have these organizations that are stretched. But it's not easy enough to say, oh, well, it's just because there's not enough funding. Just fund organizations. I just came back from 3 days up in the northern part of the island, meeting with communities up there, because there's just some really profound issues that we need to be dealing with, especially in rural and remote communities, because how do people access services? And so you're starting to see people actually moving to city centers for no reason other than they've got a child that has a special need and they can't get services. And that's not good enough in my mind. That's not the solution. So we're up talking about the issues, and we're especially talking up around Port Hardy and some of the challenges that the communities are facing up there. And I was presenting to our board, and one of our board members said, well, why don't we just get up there and fund it? And that's right, but throwing money at a problem isn't a solution either. So funding is an issue, and sustainable funding is an issue, but it's not just more money, although I'm certainly going to advocate for more money. But it's not just about that. It's about the funding model. Community organizations spend almost all their time chasing dollars. That's all it's done. Back in the welfare state day, when the government believed in core funding for core services, you had that. You could have that for 10 years. You could actually know for 10 years that you have funding for a program as long as you can deliver it effectively, which means that the staff delivering that program know they have a job for 10 years. Unheard of in this sector now. They call it, annualitis. I mean, we apply over and over annually for funding. Organizations like United Way are seen as a shining light because they'll give 3 years. Nobody wants to give beyond 3 years. And it's because it's donor-driven dollars. Government needs to come back to the table. We need to have a different funding model that says we believe that there are key services in every community and we need to support them. And we'll support them with a combination of government and private dollars. I mean, I'm not advocating that we completely move back to a welfare state. That's not my place one way or the other. What I am advocating for is that we recognize that there is a role for people to give back to their community. I believe taxation is one of those ways, but I also know that there is a rising philanthropic move in this world, and that we need to tap into that as well. So we have government playing less and less of a role, and we have this increase in private philanthropy. And like I said, I am a firm believer in giving back to community. I stated it from the start. I believe in that, and like I said, I especially like, and it's not just United Way. There are other models out there like that. What I like is a model that says everyone should give back, not just the very, very rich. And that allows and provides an opportunity for workers to give back and for everyone to give back, and whatever that looks like. But we do still need government to come back to the table and start investing in the social architecture of this country. Because without it, those problems I talked about, the growing inequalities, child poverty, the rise in homelessness, the rise in unemployment, all of that's going to continue to happen as long as government doesn't come back to the table and say, we have a role to play here besides just making sure that this country has the conditions it needs for a strong economy. We need to provide, we need to see beyond that. We need to see beyond the short term and recognize that many of those conditions and many of this is about caring for the community. But like I said, we do see this role of private philanthropy increasing in this sector. And it's very interesting to me. They actually say, and I don't know the statistics, so I'm not going to, because I'm being taped, I'm not going to make it up. But we're going to see the largest wealth transfer in the next 10 years that has ever been recorded. Something like that. It's crazy. Because that's how much money is actually out there in the hands of people who are going to be transferring it to their children. And what we're talking about is that older sort of wave of boomers that made a pile of money. And now they've got it, and they made it at the same time that their tax rates were going down, so they kept more of it for themselves. And now they're going to transfer it. So there's this big move in philanthropy around how do we help people transfer their wealth so that they give enough to their children, but that we also support the community. So there's a whole growing movement around this right now, around wealth transfer in private philanthropy. And again, don't get me wrong, I will line right up and have those conversations with people, because at the end of the day, I want that money back into the community as much as we can get it. But what that does again is you're back on that same slippery slope you were before World War II, which means we have now we have fewer and fewer donors giving more and more money. That's the shift. That's the trend for funding in the nonprofit sector. So all of a sudden, you have all of these what we call major donors, people that are actually giving quite significant amount of money back into the community. But what they're doing is they're being very particular about where it goes and what we do with it. So just like in prior World War II and the sort of the creation of the charity model, we are slowly moving back to what we call donor-directed giving. And if it's going to you, that's great. You're like, cheers, and you take it. But if you think about understanding community in its widest sense, and that idea of an interconnected services and supports and programs and initiatives, and needing to make sure that all that's working well, that's harder to do with philanthropic dollars, because you're really just trying to sell yourself to someone to get that money back. If you're successful, that's great. But again, for those organizations that would be dealing with people that maybe aren't as appealing to that donor, you're back again on that whole slippery slope around who deserves help and who doesn't. So, rise in private philanthropy, and there's lots. The rise in private foundations and family foundations right now is as astronomical because there's all this wealth that needs to be managed. But it does, at the end of the day, it does mean we're going to end up with, I think, some pretty profound inequities in this sector that will impact it in the next 10 years. And we'll start to see organizations, potentially those that aren't able to demonstrate fast outcomes because their folks are so complex, or organizations that are dealing with people that are just harder to sell to donors. We're going to start seeing something happen around that. And we're going to start seeing those organizations getting into trouble. And that's why bringing back the public sector and public dollars into the equation is so important, because they're value-based, but they're not judgment-based, if that makes sense. because it's value, and the value is that everyone deserves them. The judgment isn't, oh, I don't like how you've lived your life, therefore we're not going to give to you. The other threat to the sector, and a very profound one, is this whole idea, the profound limiting of the role of advocating in the community. There's actually been changes. Canada Revenue Agency has actually changed what organizations can do. You have to have charitable status to be able to write a tax receipt. So that's the golden goose. Everybody works to have that, because if you have that, then you give back a charitable tax receipt, you incentivize people to give to you. We now live in a situation where communities can no longer advocate. They can do nothing that is deemed political. Organizations with charitable status can do nothing that is deemed political. And that definition has been expanded to include any discussions around system or structural changes that will impact the delivery of their services or the lives of their clients, which is kind of important, because so many of the things that happen to people, so many of the reasons people end up where they are is because of systemic and structural issues, including issues like racism. I mean, racism has a systemic and structural element to it. So you've got to be able to address these issues. So we have this serious limitation right now around the role of advocating. And what that means is that nonprofits are busy peddling the bike. They're like ducks. You know, they're going underneath the water. You don't see it, but they're just trying so hard to keep everything okay, to do more with less. They know that there are changes that need to happen, but they can no longer talk about it. So they're feeling a little disconnected from the powers that be around some of these changes, and they don't know how to play in the policy world. So this is a real challenge, because what it means is that how are we going to really know what things need to change, what structural and systemic issues need to be addressed, if the people on the ground can no longer talk about them? And that is what's happening. But despite all this, it's an extremely vibrant and creative place to work. I could not imagine working anywhere else other than in a nonprofit organization. Part of it is because this is the sector that continues to fight the good fight. This is the sector that continues to struggle against what can at times be insurmountable changes. I often have colleagues that work in other sectors say to me, why? Why do you continue to do this? And it's because I don't know how to not continue to do this, because if you believe communities are important, you fight for them. And part of that fight is to work with communities. You can't do it alone. And this is the sector that believes communities can and will be strong, inclusive, and welcoming. This is where I go every day and live my values. And that's a really cool thing, because not many people can say that they can live their values every day at work. But I get to do that. And I get to know that every day, no matter what I'm doing, in some way, it's going to make a difference in someone's life. And that's a pretty cool thing. Even as a funder, I get to know that, because then I go and I meet with the programs and I see the changes they're doing. I see some of these collaborative initiatives around some of the poverty alleviation work that's going on locally, and I think, you know what? People say, oh, why are you taking on poverty? You can't deal with it. You know, they'll never solve that. And my response is, therefore, we ignore it. But you know, it just doesn't make sense to me. So, but as a community, I see community doing stuff, and I see it in the grassroots. I see it in community development organizations, in neighborhoods, working with people, getting people together and having dialogues. And people will say, well, all you're doing is sitting and meeting. It's like, no, go and watch how communities will actually transform as people who did not have connections with each other start to build those connections, find those points of similarity, and start to agree on what they want to see as a community. People who would have historically thought they didn't have a similar vision end up having a similar vision. And that's when you start to see this great change that happens in neighborhoods and wider, in larger communities. So that is, in a nutshell, why this sector is a great place to work. Like I said, you get to live your values. Every day you get to try to figure out ways to create opportunities for everyone. This isn't about just the best, the brightest, or who gets in. This is about everyone. This is about equity. You get to address complex social issues, which also makes you sometimes want to just go home and, crawl into a fetal position and rock. But it really is where you get to talk about the issues that matter. And at the end of the day, you're part of strengthening the civil society, that piece of the puzzle that really, prior to the downloading into community, we didn't talk about civil society. When we had a strong welfare state, we didn't talk about civil society. We that's the plus. If there's a plus that's come out of this, is that we recognize citizens, people, working together. That's actually how communities are strengthened. Yes, government should be at the table. Yes, business should be at the table. But at the end of the day, community should be driving the bus, and civil society, and a strong civil society does that. And I believe that's it. So thank you.
Catherine, thank you for an inspiring and an inspired talk. I think you've knocked us off, or set us up in a fantastic way. We have questions. We have a few minutes, so don't be shy, I'm sure. There we go. Okay, I'll play Phil Donahue.
Oh, you're dating yourself, Michael. Phil who?
Thank you very much, Catherine. Absolutely inspiring, and I wanted to hear from you because we are human beings doing this work. So as individuals doing this work, you talked about that going home and rocking in that fetal position, being, oh my God. How do we ourselves create resilience for ourselves so that we can continue to do this work? We talked about sustainability as an organization. How do we maintain sustainability as individuals?
As individuals. That's a really good question. The last couple of years have been somewhat disheartening for me as I've watched a number of very skilled and very dedicated executive directors in some organizations go off on sick leave because they've worked themselves to that. And I think that we have to recognize that we're only as good at our job as we are if we're feeling good and healthy and strong. And I know it's very Pollyanna to say, well, we have to have a balanced life. But there is something about recognizing what we can and cannot accomplish, and that it's okay that we're not accomplishing everything overnight, that we have to sort of really celebrate the small successes, because if we don't, the big issues will overwhelm us. And I always remember I have such a bad memory. I only ever remember kind of snippets of things, but there was that saying, if you don't want to have fun and dance, don't be part of my revolution. Like, I do think we have to recognize that we can't take it too seriously. The way I've kept my sanity, frankly, two ways. I'm a big outdoor person, so I just get outside lots and I hike lots, but I also go to the communities and I engage with the people who are on the ground doing the work. And if it's the people on the ground doing the work, it's the people that they're working with that keep them going. So, there is no real answer other than I think what we have to stop doing as a sector is trying to kill ourselves. I worked for many years as a private consultant as well, and I worked with boards and management organizations around how do we survive this brutal sector. And one of the things that I have said, and people will challenge me on this, so this is a little controversial, but we have to stop trying to do everything. And if that does mean that some people's needs aren't being met, that's bad. But at the end of the day, I don't know how else we're going to get the attention of the people whose attention we need to bring the resources into the sector. So part of it, we've got to scale back what we're trying to do and make it manageable, because we're just burning ourselves out and overwhelming ourselves. And what I do find, interestingly enough, that younger people coming into the sector seem to have that figured out. It seems to be people my age that have trouble getting that. So that's the good news. There seems to be this recognition of, yep, this is a problem, but we can't deal with it all right now.
Other questions?
Thank you, Catherine. Can you hear me?
Oh,
okay. My question is just sort of that last statement you said. I see that our generation, or the sort of middle-aged people, are very heavily involved in this nonprofit sector. Are you seeing a lot of younger people coming in or coming up to take it over and on as we retire and move forward?
It's interesting. I'm seeing a wave of young people now. What I'm not seeing is there's a whole group of people getting ready to retire, and there's a whole bunch of people coming in. What there isn't, there's a little less in that middle area. So I think there were about 10 years ago, that time, weren't as many people coming in. But I am starting to see more young people come in now, because there seems to be this resurgence around I can make a difference.
Thank you, Catherine. That was really inspiring. That was great. The question that I had was about, you were talking about little organizations like Oasis, and you've got Kool-Aid and you've got Our Place. One of the issues that we seem to run into all the time in the community is the one of communication and energy and time spent on doing things or attending to issues that somebody else has already done. So it's that conserving of energy to make sure everybody's kind of doing their own thing, connecting, but that you're not duplicating efforts or triplicating.
Yeah.
If you could just speak to these things.
So I think there are two things there. There are two levels at which we have to work, and it's harder to do this with less resources. So that's the other thing. We've got to start prioritizing connecting and not just saying, I can't do that because I'm busy dealing with this crisis. Sometimes the crisis may have to go unaddressed. But I do think that on a higher level, I am a firm believer in collaborations, but not collaborations to, oh God, we have to collaborate to get funding. That's just a silly model that funders created. Show us how you collaborate and we'll give you money. But actually saying, who are the people who are dealing with the same clients as I am, or who are the people that are dealing with the same social issues that I am, and how do I create a place where how do we create a place where we'll come together and really, and prioritize that working together. And I'm seeing that here in Victoria more than I've seen anywhere else. And I think it's because this is also one of the most under-resourced communities I've ever worked in. And because of that, people are collaborating more. So at a high level, we need to start prioritizing, getting in the room together, and collectively saying, how are we going to use our talents, our capacities, and our resources better? I also think on a client delivery level, there's an issue as well, and that's that whole idea of integration. We've got to have more coordinated, integrated models that say, we are all doing this work, but there's a client in the center, and we have to figure out how to wrap around them or their families or that community and do it better. And they call them integrated service delivery models, and I'm a very big component of that. I think, I always hate to say this, but I still think we can work smarter. And I think that's one of them, is integration, and integration across community issues.
Thank you, Catherine. I actually have two questions. One, when you're working in a really low-resource community, sometimes I hear that it's good for collaboration, sometimes I hear the opposite, that it increases the competitiveness, that people don't work together because they are competing over dollars.
Yeah.
And I'm hoping the second question you might answer is, what do you see the value or the potential for more hybrid models that are a combination business charity?
Yeah. So for your first question, you're right. It really, lack of resources can do, that scarcity mentality is a very, very bad place to be, because elbows go up and you're like this, I have to protect what's my own. So it can go either way. In this community, and I think it's because there's just a unique history in this community, it has resulted in far more collaboration, I think. There are still organizations out there that I think want to just build their own empires because they're like, I'm so tired of collaborating, I'm just doing it my own way. But I think generally speaking, there is such a recognition in Victoria of grassroots community-driven initiatives. So that's what I think keeps people collaborating. Because if you really have a community-driven versus a service delivery model, I think it's harder to be isolated because communities are more collaborative. And your second question was, sorry. Oh, hybrid. Oh, I'm a huge fan. My background is actually community economic development. That's why I'm a firm believer in community economic development as a way of stimulating both community vibrancy as well as nonprofit. And frankly, if we're not going to go back to the days of having more funding through public sources, nonprofits have got to figure out a way to have some type of income that's not tied to a million strings, because philanthropic dollars are too tied. So I'm a firm believer. I am working with organizations all the time to say, let's look at a social enterprise model. Is it a silver bullet for the sector? No, and I always am very clear with organizations to say, if you don't think you have the capacity or the interest, please don't go down this route just because you need money, because it's got to be easier to write a grant application at the end of the day. But if you do believe that you have something that would be in that realm, I think it's very important to explore. But it is a different mindset. It is a different set of skills. So again, my recommendation always is don't get the likes of me working on your business plan. Like, bring in somebody who actually understands. That's what we like. That's why we love Van City. because they've actually taken that hybrid model, and you can actually go and, a banker come social worker will come in the door and sit down with you and help you figure out a business plan.
Okay, we have a couple minutes left. So we've got just about 5 minutes. So
I don't want to get the card.
Hi, Catherine. Thank you so much for the presentation. I was just wondering if you can make any comparisons to other countries or other jurisdictions for models that they have there and how they got to that place. Good models.
Ooh, wow, I could be here all day. It's funny, and anyone who knows me and knows my politics, they always giggle when I say this because it's so not who I am. But do you know the best community organizing I've ever seen in the world is in the United States? You know why? Because they've never had any programs. It's born out of necessity. The work that is done in inner cities in the States has blown me away. But like I said, born out of a model that's been pretty harsh, so I'm not a big fan of it. But I do believe that if you look at some of the things that have done, and again, ironically, there's really big foundations in the States that fund community organizing and grassroots development kind of things. So again, there's some really interesting models in the States that are looking at that. But I guess for me, if I was to talk about really interesting, innovative models, I think we have some in this country. Ironically, they're in provinces and parts of the country that are somewhat overlooked. So Alberta is the only province in this country whose provincial government funds their municipal government to deliver community-based prevention programs. That is probably one of my favorite models in the world. It's called Family and Community Support Services, FCSS. It is legislated. It is a legislative act that says that every municipality in Alberta will receive a per capita amount of dollars based on their population that will be delivered however the municipal government sees fit. They can deliver it themselves or they can just do it as a funding pot. And the key is prevention services. I cannot say enough about that model, and I'm always talking to people across Canada saying, we should be advocating for something like this. Like, provinces need to come back to the table. That province has done it. And it's been there through good times and bad times, so it's not like it's going to get cut the minute oil is as it is today. It seems to be something that is tried and true and that they're holding dear to, and I think the municipalities would go crazy on their heads if they did try to cut it. But I like models that combine government, different levels of government, with community and business. I think everybody needs to come to the table.
okay, we have time for one more.
Kind of building off other communities. This question might be over my head. I'm not even sure if I understand it, so I hope you do.
Oh, good.
So we look at, everyone says happy people live in like the Scandinavian countries, those Nordic countries that still kind of use the welfare state models. Does that mean that you talk about how the devolution to community level has built communities up? So those countries that still have much higher level funding coming down, is there less of a sense of community in those countries, or is it a higher level community, whereas they look at it from a nation state instead of a community state?
I think it's both. I mean, I think that's a very good question and a very hard one to end on. Thank you. No, the good news is it's early in the day. It is. I mean, it's problematic because every time you see, suicides are highest in Northern European countries, the people of a certain persuasion go, see, that's the problem. They're not working hard enough. So, I mean, I do think we have to be careful about saying, one system is better than the other. The stats still show that at the end of the day, they still come out higher on all the developmental outcomes, bottom line. So you can't argue with that. What's the impact on community? I think communities are still, I think they're hit and miss. They're some are very vibrant. You go to a place like Copenhagen and you look at some of what's going on in some of those communities, it is really rather astounding. My bigger concern with the Scandinavian countries, with Northern Europe, and the way the welfare model continues to be implemented, I worry more around social inclusion and exclusion of newcomers. That's where if there was one thing that kind of worries me about going forward for Northern Europe, it's that they haven't done a good job of figuring out how to integrate people into a welfare state. They give them services, but they don't integrate people. So I think that's a bigger challenge, and that at the end of the day is going to impact what that community looks like. But I think at the end of the day, you need both. You need enough support coming from government because philanthropy will never take the place of government dollars. I don't even know what the numbers are, but it's probably $1 is raised through philanthropy for every 10 that's pulled out of the system. So we've got to continue to have government dollars, but we also need to make sure that communities are part of the equation and not just being done to by those services. I just answered around it.
Well, Catherine, again, thank you so very much. What a great start to our conference. And it's clear that we've chosen the right person to speak passionately and insightfully about this complex set of issues around this very important sector. Thank you so much.
Well, thank you. It was my pleasure. I did it. Thank you. Thank you very much. That was great. And enjoyed the rest of your 2 days.
Okay, we're going to have a quick break till 10 o'clock. So there should be refreshments out in the foyer. Just a couple of house rules. Those folks who are on tap to be presenting in the first session this morning, I invite you to come and take your place down here. And Kathy Worthington is going to be our moderator for the morning session. So enjoy, everybody, and thank you again, Catherine.